Hi class, I'm here to talk about data mining, and the article that I researched was Data Mining in Nursing Care Plans of End-of-Life Patients, and it was a study done to improve healthcare decision making. So we're going to talk about what exactly is data mining. We're also going to discuss the study itself and the improvements of healthcare decision making. And lastly, we're going to talk about the conclusion and what the findings were of that study. So what exactly is data mining? Data mining is also known as knowledge discovery. It provides an influential approach to extracting the care-related patterns and hidden correlations that become meaningful information for benchmarking and best practice. So why do we use data mining? We use data mining to build and represent nursing knowledge and relate it to the data in patients' records. If collection, storage, content of information is not standardized, you get what's called noisy data. And with that remaining, what that does is it masks the effects of important variables. Poor data collected from the electronic health records that are not standardized, the depth of discovery within the information that's given to you is very limited. So now we're going to talk about the study itself. One of the things about electronic health records I wanted to bring up was if you don't utilize electronic health records to its maximum potential, capturing data and extracting information to improve quality of health is very important. So being able to utilize electronic health records in that way is very important. And this study kind of shows how you can do that. So this study was done to reveal hidden patterns in nursing care documentation with standardizing nursing terminology. It involves the use of data mining techniques collected by 569 end-of-life patients. So why was this study performed? End-of-life care makes up a large part of healthcare expenditures. Approximately 30% of these expenditures go to 5% of the patient's beneficiaries after the end of life. 1/3 of Medicare expenditures in the last year of life are spent in the last month of life, and that can equal up to over $300 million in care. So these costs obviously are very expensive and they're expected to rise. So what are the materials and the methods of this study? The materials and methods of this study, it was conducted over 3 years, and it was a convenient sample of 4 hospitals, and which weaned it down to about 8 different units. Data was collected, and it consisted of all nursing care plans entered into the HAND system during each hospital stay, and we'll talk about what the HAND system is up here. An episode refers to the plan of care that the nurses document at each handoff, and the underlying data set was based on standardized language in the form of nursing terminologies. So what is the HAND system? The HAND system is an electronic application and database that nurses use to track and enter patients' clinical diagnoses, outcomes, and interventions within their hospital stay. The HANDS documentation method also is one example of the end-of-life patient care and how it captures nursing care in electronic documentation system and how it can become a source of a powerful evidence to transform nursing and healthcare in practice. Next, we'll talk about the main attributes in each plan of care and what they were looking for. The main attributes available in the database for each plan of care include patient demographics, nurse demographics, all nursing diagnoses, and associated outcomes and their ratings at the time of each handoff. Now over here, these are the standardized terminologies that are used throughout this study. The NANDA refers to standardized nursing terminology, and its nursing diagnoses are coded with the NANDA terminology, and that was used throughout this study. Next is NOC, and that stands for Nursing Outcomes Classification. And lastly, the NIC, which stands for Nursing Intervention Classification. Throughout this study, there were 5 indicators that were present, and the end-of-life episodes that were analyzed and the indicators that were present included these 5 here, which was the NOC outcomes, which was comfortable death, the NOC outcome of dignified life closure, NIC intervention, which is dying outcome, and discharge to hospice facility, discharge to hospice home care, and lastly, if the patient had expired. After the breakdown, there was a total of 1,425 episodes that met in this criteria. Next, the episodes were then isolated and recorded based on meeting at least one of the NANDA pain diagnoses. The final sample for analysis was 569 end-of-life patients. Next, we'll talk about the data mining methods. The data mining methods that were used was the associations mining, and this identifies hidden correlations that may be present among different attributes of the data. Clustering techniques, this allows determinations of the different groups that have similar characteristics. And classification techniques used to derive performance measures. When this study was done, a public domain data mining software was used, and that was called this RapidMiner data software. And it was used because there was such a large sample, and it was used to determine the statistical significance of results of this study. So the results of this study was that the end-of-life patients with hospital stays of less than 72 hours was less likely to meet pain relief goals compared to patients with longer stays. The NIC intervention, combination of pain management, positioning, and medication management, all had positive results, but they were only used in 81 episodes out of the 569. 56.4% of patients improved and met the expected outcome rating between the 12th and 24th hour of care. The statistical analysis of this study was that patients were clustered based on the initial pain condition. This was the NOC outcome rating at the end of the first plan of care that we had talked about earlier. To reduce the noise in the data, the 5 pain levels were then categorized into 3, and they brought those 3 categories down to severe, medium, and no pain. Patients were then categorized into 9 static clusters using the K-mean algorithm. And lastly, association rule mining investigated the interaction between the pain outcome, which was the NOC, and the top 5 nursing diagnoses, which was the NANDA. So now I'd like to talk about the conclusion. The conclusion of the study that we found was the reason the data mining tools worked in the study was simply due to the standardization of the language used in the dataset. By standardizing the nursing terminology and architecture of the database, noise data was reduced, and the findings were able to support powerful evidence in improving care of the dying patient. This study also uncovered that systematically integrating nursing intervention classifications with the electronic health record has major benefits. After reading this article and learning more about data mining, I really started to think how I would envision using data mining within my area of practice, which is the operating room. Currently in the operating room, surgical durations are estimated by our scheduling and e-record system. They are found by taking averages of the procedures And really, that's all that they look at